Hi there, my name is Carla and I'm a certified orthotist and also a registered orthotic technician. I have been working in the profession for almost 30 years. I also used to teach the technical program in Prosthetics and Orthotics at George Brown College, and I was an instructor there for almost 25 years as well. My specialty is pediatrics. I also see adults as well with varying disabilities. Those disabilities range anywhere from cerebral palsy, stroke, diabetes, to less complicated as far as feet and things go as well. So Certified Orthotist assesses individuals for their bracing needs. And then we determine in conjunction with the patient, the doctor, and also physiotherapist what type of a device would best help them functionally or positionally. As process goes, typically we'll do a muscle strength, range of motion testing, we'll do a gait analysis, and from that determine weaknesses and strengths. And then if there is a device that's needed, then we take a cast, which involves typically putting either a plaster wrap or a fiberglass wrap around the affected limb, which could either lower extremity or upper extremity, could also be your spine. And then from that cast, we fill that cast with plaster so that we end up with a three-dimensional model that we have to work from. Then we choose various plastics or it could also be carbon fibers, etc., different foams, rubbers, etc., in order to make the device. We'll mold that around the three-dimensional model, and then we finish, fabricate it, and then we'll fit the device. Then the individual will come back and we'll have them walk and see what adjustments that need to be made. So goal for any device is either to make someone much more functional. If there's a joint which is compromised, then we'll try to restrict ranges of motion and provide stability. And at the end of the day, it's to also conserve energy, especially for those that require a device for ambulation. It could be to help with straightening out if it's the spine, putting it in a better position so that joints and other muscle groups are less compromised. So, and of course we always want to make a device so that the patients and families, end up with something that they can feel better about having it on, being able to take more steps, being able to walk essentially, or prevent contractures, things like that. I love my job because it's just, it's very rewarding. I mean, I'm sure you've heard a lot of people say that, but it is, it's very rewarding. My goal is to help families. I want to have an outcome and that is such that, somebody can come in here and I've made their life better. It might be even something grandiose or it could be something just simple that I'm just relieving a little bit of discomfort that they've had. Or it could be something where I make the difference between somebody walking and not walking, right? So it's all about just making people have better lives at the end of the day. That's all I ever want.